Robertson.
Mr Speaker, let's be absolutely clear about what has happened here, because ministers who've stood up have tried to say, oh, this is a very good deal. We need to have people in these facilities. It'll bring staff together. It'll have efficiencies. That's not the debate. The debate is that the Ministry of Health, with the Minister of Health, along with a Minister of Finance looking the other way, have come forward only when they were forced to acknowledge that they didn't have the $24 million that were required for this. And then when they were found out about that, they tried to cover it up. That's what we're talking about here today. A ministry who somehow or other got past the Treasury $24 million of spending of money that they didn't have. And the Treasury have been very clear, Mr Speaker, in the papers that have come out, that had they been consulted when this idea first went up, they would not have approved it. On this side of the House, we find it extremely hard to believe that the Treasury are not consulted about an expenditure project of this scale, and we'll be digging in further to that. But if we accept that, then this is not just a little financial mistake, as the Minister of Health would have you believe. This is serious financial mismanagement, and it's a cover-up. And, Mr Speaker, New Zealanders deserve far, far better than that. And my colleagues Andrew Little and Annette King have outlined the details of this case. What I want to say to this House and to the people of New Zealand, Mr Speaker, is that it is quite clear in the third term of this government they've got arrogant, they've got out of touch. They somehow don't think that $24 million matters. They somehow want to brush off $24 million wasted, or $18 million now that has to be found, but $24 million doesn't seem like a big sum of money. $26 million on a flag referendum doesn't seem like a big sum of money to this government. $10 million owed to KiwiSaver policyholders because they haven't had their contributions passed on is brushed off by this government. This case here is typical of an out-of-touch government in their third term. They don't care anymore if they waste $24 million. Well, on this side of the House, Mr Speaker, we know what $24 million could do in the health system. We know that it could deal with the operations of people who come into our office every day in pain because they're not getting operations under this government. We know that that money could go into helping ensure that young people aren't growing up in cold, damp homes that are giving them respiratory illnesses and skin diseases that are showing children show up in hospital in greater numbers than ever before. Because that's what $24 million could give the health system. But instead, this government wants to cover up the fact that they have wasted that $24 million, and we're now $18 million, which will have to be found year in, year out in budgets. Mr Speaker, this case is one where the government needs to own up and take responsibility. Where was the apology from Jonathan Coleman today? Where was the apology from Jonathan Coleman that he and his ministry tried to hide the fact they didn't have the money for this project? $24 million, they tried to hide it. They came back to Treasury asking for $18 million, and then someone in Treasury asked the right questions, and then it comes to light. But it only came to light this week because of the good work of Annette King and the research unit of the Labour Party. No one on that side of the House was putting their hand up to say, we had serious financial mismanagement. Those are the words of the Secretary of the Treasury. Serious financial mismanagement. This is a year ago, Mr Speaker, that this was discovered. A year ago. Not one peep from the government in the last year. They hid it, they covered it up. They didn't want New Zealanders to know. And it's only emerged because the Labour Party has brought it to the attention of New Zealanders. Well, Mr Speaker, I'll tell you this. We will keep doing that in the health sector because this government is mismanaging the finances of New Zealand. They've got their eye off the ball when it comes to Bellingish and Treasury, and we've got a Ministry of Health that wants to cover things up. New Zealanders deserve far, far better than that.